If you're a woman over 60, I want to ask you something that might feel a little personal. Have you noticed yourself retreating into certain routines that bring comfort, but perhaps also leave you feeling more tired, less connected, or not quite yourself? For many women in this stage of life, a quiet habit develops. It might be settling into the same chair each evening, pouring that nightly glass of wine, reaching for a small dessert, or spending hours in front of the television or scrolling online. These moments feel safe, familiar, and comforting. Yet over time, when they begin to replace true connection, movement, and nourishment, they can quietly chip away at your energy, your heart, health, your clarity of mind, and even your relationships. My name is Dr. Perriera. I've been a physician in women's health for more than 30 years. I've walked alongside thousands of women through the complex changes of menopause and aging, and I've seen both sides of the story. I've seen women who feel vibrant, resilient, and deeply connected in their 70s. And I've also seen women who struggle with fatigue, fogginess, emotional distance, and physical weakness, often blaming it on just getting older. But age alone isn't the full story. Many of these struggles come from habits that no longer serve the body in its later decades. What once felt harmless or even restorative can after 60 trigger a cascade of changes that quietly drain your vitality. Now I want to be very clear, this is not about judgment. Solitary routines, whether it's a favorite show, a puzzle, or a sweet treat, are not bad. They only become concerning when they replace the balance your body needs to stay strong. And here's the hopeful truth. With small shifts, you can restore that balance. You can feel lighter, more energized, and more present with the people who matter most to you. Over the course of this series, I'm going to walk you through 5 real science-backed effects that happen when women over 60 over-rely on solitary comforts. These are not rare or unusual. In fact, you may recognize yourself in some of these stories. I'll also share with you practical, natural ways to respond so that you can protect your health without losing the small joys that bring comfort. But before we dive into those lessons, let me pause and invite you to take one small action. If you want honest, compassionate conversations about health in later life, I encourage you to subscribe to this channel. This is a space built for women like you, where science and warmth go hand in hand. And if what I'm saying already resonates, leave me a 1 in the comments below. If you're not sure yet, type 2. Your feedback helps me create content that truly serves you. Now let's start with the very first and perhaps most common warning sign: fatigue that runs deeper than simple tiredness. Many women chalk it up to age, but often there's more beneath the surface. I'll never forget Brenda, a 68-year-old retired teacher who walked into my office looking utterly drained. She said, "Dr. Perriera, I don't understand it. I sleep 8 hours every night. I eat fairly well. But I wake up exhausted, and I have to nap just to make it through the day." When I asked about her evenings, she admitted, "Most nights I unwind with a glass of wine and a slice of cake while watching TV. It's the only thing that relaxes me." This is a story I've heard countless times. What seems like a harmless routine can actually place a heavy burden on the body after 60. Here's why: as we age, our metabolism and hormone systems become more delicate. The Mayo Clinic notes that older adults are more sensitive to fluctuations in blood sugar, and even modest amounts of alcohol can disrupt sleep cycles. That nightly ritual of wine and dessert was sending Brenda's blood sugar soaring only to crash later. The result? Sleep that looked long on the clock but was shallow and unrestful. Her cortisol, the stress hormone, was also being disturbed, creating a cycle of inflammation and hormonal imbalance. This is why so many women describe bone-deep weariness, sluggish thinking, or lack of motivation even after a full night's rest. It's not simply aging, it's the body's response to habits that no longer match its needs. In younger years, the body bounces back. But after 60, recovery takes much longer. When Brenda and I worked together, I didn't tell her to give up comfort. Instead, we shifted it. She swapped the wine for chamomile tea and the dessert for a handful of cherries. She created a calming bedtime routine with light stretching and a favorite book. Within 6 weeks, her energy was transformed. Her husband noticed her smiling more. She told me, "I feel like I have my spark back." That's the message I want you to take to heart. Your body is not failing you. It is communicating with you. When you feel persistent fatigue, it's not simply old age, it's a signal asking for a different kind of care. And when you respond, the rewards can be remarkable. But fatigue is just the beginning. Because the same patterns that drain your energy can also place hidden strain on another part of your body, one that we simply cannot ignore: your heart. And that's exactly where we're headed next. When we think about aging, many women expect to feel a little slower, perhaps a little more tired. But far fewer expect that something as ordinary as sitting for long periods or reaching for snacks while browsing online could quietly strain the most vital muscle in the body: your heart. Yet this is exactly what I see in my practice. And it matters, because according to the National Institutes of Health, heart disease is still the #1 cause of death for women over 65. What makes it especially concerning is that the warning signs can be subtle, often disguised as normal aging or simple stress. I remember Carol, a 72-year-old grandmother, who came in for what she thought would be a routine checkup. She loved gardening and took real pride in eating well. On the surface, she seemed like the picture of health. But as we talked, she admitted something hesitantly. "Dr. Perriera, I've gotten into the habit of spending hours online, sometimes shopping, sometimes just scrolling. I snack while I do it, and afterward my heart feels like it's fluttering. Is that normal?" That question stopped me because I knew it wasn't simply nerves. Carol's story is a common one. When you combine long hours of sitting with sugary or salty snacks, your heart and blood vessels experience what I call a double hit. First, the lack of movement means your circulation slows, blood pressure begins to rise, and your muscles, including your heart, don't get the oxygen they need. Second, the processed foods that often accompany these routines spike blood sugar and trigger inflammation, both of which stress the cardiovascular system. The body may feel relaxed in the moment, but internally, it's like running a quiet marathon. When I measured Carol's blood pressure, it was slightly above the healthy range, not high enough to need medication yet, but a clear warning sign. Many women don't realize that blood pressure, even a little above normal, can double the risk of heart disease over time. According to the American Heart Association, lifestyle habits, such as diet activity and stress management, play a more powerful role than most medications when it comes to prevention. That's why catching the pattern early is so important. Together, we worked on small, realistic changes. I didn't ask Carol to give up her online time, but I encouraged her to set a timer and stand up every 30 minutes. She started walking around her house, doing light stretches, or simply stepping outside to breathe fresh air. We replaced her processed snacks with a small bowl of almonds and blueberries, foods shown to support heart health. And instead of scrolling in silence, I suggested she call a friend for 10 minutes. That shift gave her both movement and connection. Within weeks, Carol's fluttering sensation disappeared. Her blood pressure readings improved, and she told me something I'll never forget: "I feel like I'm not afraid of my own body anymore." That is the kind of transformation I want for every woman listening today. It's not about perfection. It's about giving your heart the small acts of care it needs now. Another piece many women overlook is the role of emotional well-being. The Mayo Clinic has highlighted that loneliness and isolation are linked to higher cardiovascular risk. When solitary habits replace connection, the heart not only suffers physically, but also emotionally. A quiet house, endless hours on a screen, or evenings without meaningful conversation may look peaceful, but the body often interprets it as stress. And stress, especially when chronic, raises cortisol levels, increases blood pressure, and puts further strain on the cardiovascular system. The hopeful part is this: your heart is remarkably responsive. Even in your 60s and 70s, small changes can produce measurable improvements. Short walks after meals help regulate blood sugar and lower blood pressure. Gentle breathing exercises calm the nervous system. Choosing whole foods like leafy greens, berries, and salmon supports healthy arteries. And most importantly, staying socially connected gives your heart both emotional warmth and physical resilience. I often tell my patients that the heart is more than a pump. It is a living, responsive muscle that reflects not only what you eat and how you move, but also how you live and who you connect with. If you nurture it with intention, it can serve you with strength and stability well into your later years. But heart health is only part of the story, because as many women discover the same patterns that fatigue the body and strain the heart, can also cloud the very center of your identity, your mind. If you've ever walked into a room and forgotten why, struggled to recall a name, or felt an unshakable fog over your thoughts, you know how unsettling it can be. And that's exactly where we're heading next: the hidden connection between solitary habits and memory lapses. Have you ever walked into a room only to forget why you went there, or found yourself searching for a word that's usually right on the tip of your tongue? Many women over 60 describe this as just getting older. But what I want you to know is that these moments of forgetfulness often have more to do with lifestyle habits than with aging alone. In fact, research from the National Institute on Aging shows that while some cognitive changes are normal with age, others can be influenced positively or negatively by what you eat, how you move, and how you spend your quiet hours. I think of Roberta, a retired teacher in her early 70s, who came to see me with tears in her eyes. "Dr. Perriera," she said, "I'm forgetting things. Not the big things, but the little ones where I put my keys, why I walked into a room, or sometimes even a student's name from years ago." My daughter worries it could be dementia. But then some days, I feel sharp as ever. What's happening to me? We ran tests, and her brain scans were clear, no sign of dementia. That was good news. But it didn't answer her question. So I asked about her daily routines. That's when she admitted, "Most nights I sit down with a bag of chips and watch old movies. It's my comfort." Roberta's story is familiar. Many women unknowingly fuel brain fog through patterns of eating and inactivity. Processed carbohydrates and sugars send blood sugar soaring, then crashing down. Each spike and dip creates inflammation that doesn't just affect the body, it directly impacts the brain. According to studies published in Neurology, high blood sugar and poor metabolic control are linked to cognitive decline, even in older adults without diabetes. Add in long hours of sitting, limited movement, and emotional isolation, and you create the perfect environment for foggy thinking. It's not only memory that suffers. Neurotransmitters, those tiny chemical messengers that allow your brain to focus, learn, and regulate mood, also take a hit. When your brain is flooded with inflammatory signals, levels of serotonin and dopamine may dip. That's why so many women tell me they not only forget things, but also feel unmotivated, low in mood, or disconnected from themselves. It feels like a grey cloud has settled over their mind. And because it comes and goes, they dismiss it as just being tired. The encouraging news is that your brain is adaptable. Just as poor habits can trigger fog, better habits can clear it. For Roberta, we started with small steps. She cut back on nightly chips and replaced them with a few walnuts and apple slices, foods rich in omega-3s and antioxidants that support brain function. She made hydration a daily priority, since even mild dehydration can impair memory. And she began walking outdoors 3 times a week, combining gentle exercise with fresh air and sunlight. Within 2 months, her daughter laughed and said, "Mom remembers my birthday again. I'll take that as proof." Roberta herself said she felt like a veil had lifted. What's powerful about stories like hers is that they show you don't need drastic measures to reclaim mental clarity. The National Institute on Aging emphasizes that a balanced diet, regular activity, and mentally engaging tasks like reading puzzles or learning something new help protect memory. And I'll add, this social connection is medicine for the brain. Conversations, laughter, and shared experiences light up neural pathways in ways solitary habits cannot. If you've been struggling with brain fog, I want you to take heart. Forgetfulness does not mean you're broken, and it does not mean dementia is inevitable. Often it's your brain's way of asking for steadier fuel and richer stimulation. Think of it like a garden. Left alone without water or sunlight, the flowers wilt. But with a little daily attention, they bloom again. Your mind is no different. So as you reflect on your own habits, ask yourself, are you nourishing your brain, or are you unintentionally clouding it with choices that no longer serve you? The beauty of this stage of life is that change is always possible. I've seen women in their 70s and 80s sharpen their minds, regain focus, and feel joyfully present again, simply by rebalancing how they spend their evenings. But while brain fog is unsettling, there's another effect of solitary withdrawal that can be even more painful: emotional distance from the people who matter most. That's what we need to talk about next, how these habits quietly reshape your relationships, often without you realizing it. One of the quietest but most painful changes I see in women over 60 is not physical at all. It's emotional. Over time, solitary comforts can gradually replace real human connection. At first, it may not feel like a problem. You tell yourself you're simply enjoying your favorite shows, puzzles, or hobbies. You've earned this time, and you certainly have. But little by little, the habit of retreating inward can create distance not just from the world, but from the people you love most. I think of Teresa, a 74-year-old woman who sat across from me one afternoon, her hands trembling as she spoke. "Dr. Perriera," she said quietly, "my husband thinks I don't love him anymore. He says I've pulled away and he's not wrong. I just don't know how to fix it." She admitted that when she felt lonely or uncertain, she turned to her own private world, television puzzles and books. It gave her comfort, but it also kept her from reaching for her husband's hand, sharing her feelings, or initiating intimacy. The truth is, her solitary habits had begun to replace the warmth of her marriage. This is something I see often. As our bodies change with age, intimacy may feel different. Hormonal shifts can lower desire, aches, or dryness can make closeness uncomfortable, and fear of rejection can create silence. Instead of addressing these issues openly, many women retreat into safer solitary routines. Not because they've stopped loving their partner, but because withdrawal feels easier than vulnerability. Yet over time, the cost is high. Emotional withdrawal creates an invisible wall. The shared laughter, deep conversations, and simple touches that once came naturally become rare. The relationship shifts from vibrant partnership to quiet coexistence. Science supports what Teresa felt. Studies published by the American Psychological Association show that social isolation and emotional disconnection increase the risk of depression, weaken the immune system, and even shorten lifespan. The Mayo Clinic also reminds us that meaningful relationships are not extras, but essential to healthy aging. Connection fuels mental health, lowers stress hormones, and gives us a sense of belonging that solitary habits cannot replace. The hopeful news is that rebuilding intimacy and connection does not require grand gestures. For Teresa and her husband, we started small. She began sharing her feelings honestly. "I've been retreating because I feel embarrassed about changes in my body." That single conversation opened the door to compassion rather than conflict. They also started a daily walk together, not long, not demanding, just time, side by side. Within weeks, she told me their conversations felt lighter and she felt less afraid of closeness. Her husband noticed too. "It's like I have my wife back," he said. "What I want you to know is this: withdrawing into solitary comfort is never about lack of love. It's usually about unspoken fears, physical discomfort, or simple habits that became easier than reaching out. The good news is that intimacy and connection can be rebuilt at any age. Whether it's through touch conversation or shared experiences, the smallest steps can breathe new life into relationships. So I encourage you to ask yourself, have you noticed moments where comfort has replaced connection? Do you find yourself choosing silence over sharing or distraction over presence? These are not signs of failure. They are signals that your heart and your relationships are ready for new attention. And when you respond, you may discover a deeper, more tender bond than ever before. But while emotional isolation can be invisible, the next consequence of solitary withdrawal is harder to ignore. Because when habits that weaken your body go unaddressed, the body begins to push back in very real and physical ways. That's what we'll talk about next: how a sedentary, withdrawn lifestyle can lead to physical weakness, instability, and even loss of independence, and what you can do to protect your strength. When we think about strength, many women imagine lifting heavy weights or running marathons. But in truth, the strength that matters most after 60 is far more practical. It's the strength to stand up steadily, to carry groceries without strain, to laugh without fear of leaking urine, to walk with confidence instead of worry. And here's where solitary sedentary routines reveal their greatest cost. Because when you spend most of your days sitting, your body gradually loses the muscle tone that protects your balance, your pelvic floor, and your independence. Gloria, a witty 78-year-old with a love for reading, came into my office one winter day. Usually she was full of humor, but that afternoon her voice was low. "Dr. Perriera," she admitted, "I feel fragile. I almost fell reaching for something, and I've started leaking a little when I laugh. What's happening to me?" When I asked about her daily routine, she looked down. "I spend most of my time in my chair, reading, watching TV. I thought I earned the right to rest, but now I feel broken." Gloria's experience is far more common than most realize. Here's the truth. The core and pelvic floor muscles that hold your body steady are just like every other muscle. Use them and they stay strong. Neglect them and they weaken. After menopause, declining estrogen accelerates muscle loss, making inactivity even riskier. According to the National Institute on Aging, adults over 65 can lose up to 1% of muscle mass each year without regular exercise. That loss shows up not just as weakness, but as instability, poor bladder control, and a loss of confidence in daily life. The consequences can be profound. A woman who once walked easily may begin to fear falling. Laughter once pelvic floor exercises known as Kegels to strengthen her bladder control. And I asked her to set a timer to stand and walk for 5 minutes every hour. These were not dramatic changes, but they made a dramatic difference. Within 2 months, Gloria walked into my office with a smile. "The leaking is better. I feel steady again. I don't feel helpless anymore." This is what I want you to hear. Your body is not broken. It is responding to the way you live. And even in your 70s or 80s, you can rebuild strength, stability, and confidence. You don't need expensive gyms or intense workouts. You need simple, consistent movement and the willingness to listen to your body. As we close this conversation, let's step back and look at the bigger picture. Across these 5 parts, we've explored how solitary habits, those quiet routines that seem harmless, can ripple across your life. They can drain your energy strain, your heart, cloud your memory, distance you from loved ones, and weaken your body. But we've also seen that none of these outcomes are fixed. With awareness and small intentional changes, you can restore vitality, connection, and joy. Your body speaks to you every day. Fatigue, brain fog, isolation, weakness. These are not failures. They are messages. Messages that it's time to adjust, to bring in more movement, more connection, more nourishment for your mind and spirit. The greatest wisdom in this stage of life is not to ignore these signals, but to honor them. By doing so, you not only protect your health, you reclaim the fullness of your golden years. So I'll leave you with this reflection. Have you noticed one small habit that might be holding you back? And if so, what gentle shift could you make today to move closer to strength, clarity, and connection? I would love to hear your thoughts. Please share your story in the comments below. You never know whose life your words might touch. And if this conversation has resonated with you, I invite you to subscribe to our channel. Here we create honest, compassionate content designed for women like you. Women who want not just longer lives, but fuller, richer ones. Together, we can make these years not a time of decline, but a time of renewal. Thank you for spending this time with me. I'm Dr. Lisa Perriera, and it's been an honor to walk with you through this journey. May you move forward with confidence, with strength, and with the knowledge that it is never too late to feel deeply alive again.